How you doing? My name is Noah Peltier. Today we're going to go over the pros and cons of the 5 companies we have. First one's Kaiser Permanente, then Davis Center for Behavioral Health, then McLean Hospital. Fourth is World Health Organization, Mental Health and Substance Use Department. And then lastly is MedSite Health Services. So we're going to go over we're going to go over these 5 and their pros and cons. And then we're going to start with Kaiser Permanente. The pros with Kaiser Permanente, they have a strong nationwide reputation for integrated healthcare. They offer a wide range of mental health services, including therapy, psychiatry, and crisis intervention. Their financial stability is very strong, as they are one of the largest nonprofit health plans in the U.S. Many patients appreciate the convenience of having all medical and mental health services under one organization. They have growing telehealth services, which increase accessibility. Those are the pros. And the cons is Kaiser is often criticized for long wait times for mental health appointments. Some patients feel the mental health services are not as prioritized as physical health. Providers report high caseloads and burnout within the organization. They're sometimes resistant to rapid policy changes due to their large size and bureaucracy. Certain services may not be available in all locations as well. Those are the pros and cons of Kaiser. When it comes to Davis Center for Behavioral Health, pros typically offer personalized community-based behavioral health services, often focus on patient-centered care and individualized treatment plans. Smaller behavioral health centers may provide more accessible or flexible support, provide service such as counseling, psychiatric evaluations, and substance use treatment. Cons of smaller organizations may have limited funding or financial stability compared to large hospitals. Services availability may vary depending on location. Limited staff can mean longer wait times, of course, during high demand periods. May lack some specialized programs offered by large institutions. Name recognition and reputation may not be as strong nationally. McLean Hospital, their pros and cons is McLean Hospital is one of the top psychiatric hospitals in the world, known for excellence in mental health research and treatment. They offer specialized programs for depression, anxiety, trauma, OCD, addiction, and more. Strong academic partnerships with Harvard Medical School, highly trained staff and evidence-based treatment approaches, strong global reputation, and consumer loyalty due to high-quality care. Cons is treatment at McLean is often expensive and may not be fully covered by insurance. Access can be limited. Many programs have long wait lists. The hospital's size and prestige may create a less personal experience. For some patients, services are mostly centered in Massachusetts, limited national accessibility. That would probably be a problem for me because I would want to be in Maryland or in the DMV area. But I like it though. And lastly, high operation costs can make some programs financially demanding for families as well. For number 4, World Health Organization, Mental Health and Use and Substance Use Department. Their pros is the WHO, which is also stands for the World Health Organization, is a global role in developing mental health policies and promoting worldwide mental health initiatives. Creates research-based guidelines used by countries around the world. Strong reputation as a leading international health authority. Advocates for mental health access, stigma reduction, and suicide prevention strategies. Works with governments to improve mental health system on a large scale. Those are their pros. Their cons is WHO does not provide direct clinical services, so individuals cannot receive treatment from them. As a global organization, policy changes can take a long time due to their international coordination. Funding varies and can be influenced by political factors among member nations. Some guidelines are difficult to implement in low resource countries, and large scale bureaucracy can slow responsiveness to new issues as well. For number 5, MedPsych health services. The pros is they provide outpatient mental health support, including therapy, medication management, and psychological testing. Offers a more personalized approach compared to large hospital systems. Flexible schedule and community-oriented care, often integrating both medical and psychological services for better continuity. Um, continuity, tends to be more accessible and less intimidating for new patients. Cons: smaller organization, as the others, a few others, may have limited resources and fewer specialized programs. Availability of psychiatrists or specialists may be limited. Less national recognition which can influence consumers' trust. May not offer 24/7 crisis services like larger institutions. And financial stability can vary based on insurance, reimbursement, and community funding. So overall, for me personally, the two main ones is Kaiser Permanente and McLean Hospital is my favorites. McLean because of everything they offer, how accomplished and established they are in the mental health and medical field. But the main con for McLean is that they're in Massachusetts, which I do not really want to be in Massachusetts long term at all. Excuse me. But with Kaiser, I like Kaiser just because I like what they have to offer. Excuse me. I like what they have to offer, and more so, I like the fact that they have a location in the DMV area. They have actually a few, and so, in my next video, I will talk about more, which had already passed, but which would be my decision. But thank you for your time, and I hope you all have a good one.